Welcome to our first episode for VLAB, Visionary Lab. And this is where we take small pieces from our videos and make them into practical solutions for health program managers or community leaders, whether you're in an NGO, this is for you. So our first episode in the reporting series focused on understanding your pain points. So today I've created a gap analysis. I'm focused on maternal health program, but it can be whatever program you're working on. It can be a hepatitis prevention program. It could be a HIV prevention program. It can be any program you're working with. It doesn't even have to be a health related program. But for today, we're looking at maternal health as an example. And from the video, it spoke about understanding your flow, understanding those areas that causes a lot of difficulty, challenges during the reporting cycle. So I'm hoping that you're gonna be able to see my board. I will try using other technologies in our VLAB sessions. Okay, so let me take you through our matrix or gap analysis. Okay, so we have columns going down and we have rows going across. Okay, so the first column here is reporting step. Here, reporting step. And we have 7 steps: data collection, data accuracy checks, report preparation, report review, stakeholder specific formats, submission, feedback, integration. And then over here we have, and this can be whether you're in a transitionary step, or this is what you inherited, or this is just what it is. Then we have your goal state. I like to talk about goal state. You can state it as ideal process, but I have it as goal state. We all have goals. I have gaps and action. So for the first reporting step, data collection is primary as you build your reporting process. So a current process that you may have is manual, meaning that it's paper-based, meaning that you collect from various staff or stakeholders paper. And this paper could also be in an electronic format. It could be that you are emailed the report. That is still considered paper. You can also have a mixed system in which you have an Excel-based database. You could also, for health folks, you could have a EHR and manual. So it could be mixed based on your circumstances. And then as it relates to data collection over in the goal state, it may be that you want to go digital. Maybe you're working towards an EMR process. With an EMR process or a digital process, it would take you less than a day to get the data. In your current process, if you are manual or mixed, it may take you about 2 days, hopefully no longer. And if you're in a mixed or manual state, one of the gaps could be that you have long data entry time, meaning that your staff takes a long time in entering the data from the manual paperwork into a software database system. You may also find inconsistent data points And of course, that is considered high risk. High risk in terms of your reports are not reliable, they're not accurate, and then that creates additional issues. An action could be that you want to transition from your manual to an electronic or digital or EHR system. So that could be an action. And this action doesn't mean that it's going to take place in a month or two. It could be that you're building steps towards this taking place in another year or 2 years or 3 years, depending on the plan that you have. The second reporting step is data accuracy checks. And I know based on my experience working in ministries of health, NGO setting, in the health setting, I know that this is an area of challenge. Accuracy checks. So errors are found at the point of reporting. If you're a director and you're the one who collates all the reports, you may start picking up errors during this process of building out your monthly reports, for example. And this is too late. You would want to be able to capture this from here, but we're going to speak about it again. So that's one of the in your current process, you're picking up errors in your monthly reports, for example. Of course, your goal state would be that it's automated and you are able to run checks on based on a frequency that you have determined. So it could be after the end of every day, you run a frequency check and then you are able to analyze that data the following morning. Whatever system that works for you. It would be good to know what your systems are and how you are managing the accuracy checks for your reporting. Are those checks done manually or are those done automated by your software that you're using? That would be good to know. So leave it in the comments below. One of the gaps, of course, is that you're identifying errors during the reporting process. And an action is that you want to be able to validate your data. Report preparation. And this is something that I know just gathering reports, you can become very stressed because you are waiting for reports. Reports are taking its time to come in. You know, you are just very anxious and on edge during this time. So your current process, what is your current process? So for this example, I have that staff enters data in an Excel sheet, for example. I know during various times, like when I was in New York at a federally qualified health center, we utilized the EMR, we utilized Excel sheets, and we also calculated and collected some data manually from like rapid testing, whether it's for hepatitis C or HIV. Those were manually captured, although they were entered in the EMR. No reporting template that was created for that particular data point, and so that was just collected manually and entered in an Excel sheet. So that's an example. Of course, your goal state would have all your data points collected in your digital system and have it automated. And then gaps, of course, is the heavy manual workload that staff are expected to carry and inconsistent formats. And that is for example, if you're working across departments for maternal health, for example, you may have persons contributing to your report who are inside the clinic in OBGYN, for example. You may have persons contributing to your report in pediatrics or in primary care. You could have outreach contributing to your reports. So there are so many data points coming in from different departments. So you have to make sure that there is consistent format across your indicators, or your measures are clearly defined across all departments. And so if someone, for example, is reporting on visits, it's the mother's visits as opposed to the child's visits. Those types of definition are important. And then the action here is create EHR templates. And I've found this to be very helpful, especially when you have many departments feeding into your reporting. Your fourth step here is report review. And I mean, truth be told, I've worked in systems where I was the only person reviewing, writing the reports, collating the reports, reviewing the reports. But I know there are more elaborate systems in which it goes to maybe your director, senior director, VP, ED, CEO, whatever your setup is. But what is identified here on the current process is that you may have delays in meeting the timeline, and you may also find that you have limited reviewer availability. Because the higher you go up is the more your seniors are occupied with other priorities, and sometimes reporting or your reporting is not as prioritized, and so you are unable to get your reports back in the time frame that you have allocated for you to meet for your funders. Of course, your goal state is to have your seniors schedule a time and allocate that time. And so you know that by the second of the month, or the following month, or the second of every month, your report, your draft report, would be on the desk of your supervisor. And they have 2 days in which to review the report. So by the 4th of the month, you get that report back. You're able to make any adjustments, changes, maybe investigate or validate data that was highlighted to be inconsistent, and say your reporting now should be submitted on the 5th. You now have a day. So in the goal state, where we would all like to be, scheduling those times with your seniors or your supervisors would be great. And you can absolutely work towards that. Of course, the gaps include bottlenecks, because again, there are many priorities coming on your supervisor's desk, and you may not get back your reports in the time that you expected. And so for the action, we want to work out a plan of action with your supervisor to have schedule or a routine time in which they would review and provide back your report. Number 5, stakeholder specific formats. I have worked on a program in which I had 3 different funders asking for similar information but different formats. So that could be a current situation that you're in, different funders, and you have different reporting formats. However, they are collecting, it's around maternal health, so you are collecting similar information, but data points may vary, definitions may also vary, and so you need to make sure that you are able to capture all of that. So one of the solutions I have found is to create a standardized report structure. And within that structure, and this would be your goal state, within this structure, you would create custom sections, meaning that if you have 3 funders, for example, and one asks for a table of maternal visits. I'm sure you're not able to see this clearly, but I'm speaking so you hear. Another one asks for success stories, and I believe in success stories. And they also gave you a format that you should write these, in which you should write these success stories. And say another one asks you for clinical measures. Okay. And so these are the 3 variations across the funders. The other parts of the reports are quite similar. Maybe let us say they're the same. So what I would do in this situation is that I would create one report structure that takes in all these 3 variances in addition to the common, what do you call that now? The commonalities. So those common structures that run across all the 3 funders. So for example, if they ask you for a summary of the month of activities, maybe they ask you for your spending, your financial report in your monthly report, and that's standard across all 3 funders, but each of them have these 3 nuances that's specific to them. I would create one report that has all these 3 variances in there, in addition to those common areas, those common topics, right? So it means that my team will report on all of these measures, indicators, requests. And where it is not applicable for a particular team member, they would not complete that section. Okay, so if you had it where you were completing different report formats, then one of the gaps would be that you're duplicating your efforts, right? You're creating this one report, and then you go to another report and you create another report from the data. So it's a duplication of effort. So one of the action here is create adaptable template. And so that standardized template here becomes the adaptable template. Submission. I hate to submit reports late, but it has happened. So in the current process, especially if you're carrying a heavy manual process, you may find that your reports are late, or your reports barely make it on time, and you are relieved. You're so relieved at the end because it was just so much effort. So, and you're also, because you like squeeze it in at the last minute, 11:59, you're actually not very sure of your data, and whether your data was validated, whether it's accurate. You're uncertain about it. Of course, your goal state is making sure that all your reports are submitted on time. That's what we all want. But of course, in the in your current situation where you're struggling, you may find that you have frequent delays. And so you want to automate as an action reminders for your deadlines. And automate here is quite relative because automate can be a calendar reminder here. Okay. And the last one is feedback integration. Now, I have worked in many settings, and I can say that it's really on the rare side that I did this, but I have done it closer to my maturity in public health and in project management. It's very important. When I was younger in the roles that I have had, this was like a headache. Why am I asking stakeholders for their feedback? That just carries more work. It's just more frustration. It's just more stress. But it's very important. In the current process, you may have limited stakeholder feedback, right? As I think is expected. Well, not that it's expected, but it's a common practice. Your goal state here is structured feedback surveys. The frequency, I think it's up to you based on your circumstances, your setting, how involved your stakeholders are. And your stakeholders, we should maybe define that, but let us define it after. And one of the gaps here is missed opportunities for continuous quality improvement, CQI. Where you are not aware of potential improvements that can be made, then you are limiting or restricting your growth in your program. And that's what this means right here. If you're aware that there is a growing wait time in your clinic, for example, in OBGYN, for example, because you're not in tune with your stakeholders, you're not getting that feedback in time for you to make certain improvements or test certain improvements that can contribute to the overall growth and development of your program. And that is the reason stakeholder feedback and integration is now so important, as we empower ourselves and our community to be in better health. One of the action here is implement frequency for feedback. All right, so let us circle back to feedback integration. Who are your stakeholders? So your stakeholders are absolutely your clients, your community who you are serving. They are also your funders, donors across all levels. They are also your colleagues. They are also your board. Everyone who has a stake in your maternal health program or your program that you're actually implementing. They're your stakeholders. So what I find is that your feedback can be along the continuum of formality. So you could create a survey, which we spoke about in the video. I'm not sure if that's something that you'd want us to discuss in this VLAB to flesh out what a survey could look like. So let me know if that's something that you'd want. But it can be very simple as a conversation where you ask the person, what would you want to see improved in my reporting? That could be a question. If you have very vocal stakeholders who receive your report, they may also share their opinions, whether it was solicited or not. So you have an opportunity to hear, to discuss with your team, and to see where possible to integrate it in the process. So that's it. That is our gap analysis for our maternal health program. You have the opportunity to flesh this out for your program, just to understand where your pain points are, where your goal state is, and maybe steps. We have come to the end of our VLAB as we look at the gap analysis for our maternal health program. Now, what is your program? What are you implementing in your setting? And have you conducted something like this? Maybe you didn't call it a gap analysis in your reporting process, but you have done something very similar to this, or is this something that you want to do? If you have done something similar to this, please let us know what it was and how it came out, and maybe some of the steps you are taking towards achieving your goal state. And if this is something that you need to do, maybe to present it to your supervisors, to share some of the struggles and challenges that you're having, and advocate for additional resources, for additional support, whether it is support through the data management department or your IT department. Advocacy across all levels to support you in reaching towards your goal state. Again, your goal state may take a long time to be achieved, and that is okay. The important thing is that you know where you currently are, your challenges, where you want to go, and then create small incremental steps for getting there. So we're at the end of our first VLAB, and I do hope that it gave valuable information, because we're here to make a difference for our community and to impact the lives of program leaders. Thank you so much, and I'll see you in the next episode.